Good morning. My name is Ashley Craiglow. My pronouns are she, her. For a physical description, I'm a female with shoulder length black hair, and I'm wearing glasses and a cream colored sweater. And I'd like to welcome you and thank you for joining us for today's session on how the Senior LinkAge Line can help you and resource coordination. Before we start, a few housekeeping items. We are excited to announce that today's webinar will be accessible to a wider audience. We have arranged for American Sign Language interpreters who will be present throughout the session. These interpreters will rotate about every 20 minutes, ensuring that everyone can follow the content effectively. If you need the interpretation, make sure that you click the interpretation button on the bottom of your screen, and then you should be able to click on the ASL interpreter. Additionally, we are recording the entire webinar with the ASL interpretation. The recordings will be available on our YouTube channel for later viewing. Whether you attend the live session or catch up later, you'll have the opportunity to engage with the material in a way that suits your needs. I encourage you to subscribe to our channel so that you can keep up with the latest additions to our video library. We are always looking for suggestions for future webinar topics, so if you have a suggestion on a topic or a speaker, feel free to send those to me at my email, which I will share in the chat later here. Please keep your microphone set to mute. Just note that if you're experiencing any issues with bandwidth or auto quality, it often helps to disable your camera. If you'd like, you can enter your first name and organization or community that you're from into the chat box, and then what you're hoping to get out of today's session, and then how you found out about us. If you have any questions during today's session, please feel free to enter your question into the chat, and we'll address them at the end of the presentation. We will also take some additional questions at that time. At the close of today's session, you will see a quick evaluation on today's session pop up in your browser. So if you could take a few minutes and complete that survey, it helps us greatly when planning future sessions. And then one quick last reminder to visit our Facebook page for more information about upcoming sessions, such as we have a great webinar on home modifications next month. All right. So a little bit about the Arrowhead Area Agency on Aging. The Arrowhead Regional Development Commission is designated by the Minnesota Board on Aging as an area agency on aging for the planning and service area under the authority of Title III of the Older Americans Act. The Arrowhead Area Agency on Aging, or the Quad A, is committed to helping older Americans maintain their highest level of independence. Area agencies on aging are regional organizations that provide the services, supports, and information for just about everything that older adults and their families could need. Minnesota has 7 AAAs across the state that are the local connections to older Minnesotans and the community support they need as they age. The Arrowhead Area Agency on Aging's planning and service area, as designated by the Minnesota Board on Aging, includes the counties Aiken, Carlton, Cook, Itasca, Koochiching, Lake, and St. Louis. Now I'm going to take a moment to read our Arrowhead Area Agency on Aging land acknowledgement. So as we support our mission to help older adults maintain their highest level of independence, we do this while being respectful of the space we are being welcomed into by Indigenous people. We strive to deepen our understanding of the multiple ways in which people see and understand land and acknowledge the Indigenous people who have relationships in this land. We also acknowledge the decades of historical trauma, loss, and grief experienced by Indigenous people. It is our promise to not only recognize these truths, but also to take action to show support of our Indigenous elders, neighbors, and friends, and understand our place within the past, present, and future of this land. We know this is just one step in recognizing and honoring the sovereignty of tribal nations. So sorry about that. I am going to turn it over to Jess and Allison to start talking about our topic today.
All right. Thanks, Ashley. My name is Jess Langer. My pronouns are she, they. I am a white woman with brown hair wearing a quilted sweater, and you might see my little white dog pop up on the screen. He likes to sit on my lap during webinars. I'm the Education and Volunteer Coordinator for the Arrowhead Region's Senior Linkage Line Contact Center, and I'll pass it over to Allison to give her introduction before we begin.
Hi, thanks, Jess. I'm Allison Olson. I'm a resource coordinator with the Arrowhead Agency on Aging. And I go by a she pronoun, I guess. And I'm a white woman with light brown hair, and I'm wearing a black jacket.
All right. So today we are talking about how the Senior Linkage Line can help you, and then we'll also talk about pre-admission screening and resource coordination. So the Senior Linkage Line it covers the state of Minnesota. It's a statewide service of the Minnesota Board on Aging in partnership with our Minnesota area agencies on aging. So no matter, which of the state's 87 counties you live in, the Senior Linkage Line can help. We have call centers across the state, so local staff can help you. So up in northwestern Minnesota, the office is in Warren, that's Dancing Sky Area Agency on Aging. In the northeastern corner, that's us. Our office is in Duluth, the Arrowhead Area Agency on Aging. Central Minnesota, their office is in St. Cloud. That's our Central Minnesota Council on Aging. Trellis is in the metro area. They're currently moving their office to Minneapolis. Mankato is Minnesota River Area Agency on Aging's office in South Central, and they cover Southwest Minnesota. And then Rochester in Southeastern Minnesota for the Southeastern Area Agency on Aging. So the Senior Linkage Line provides services that are free, neutral, and objective. Free meaning we provide services to any Minnesotan, and we're funded through state and federal dollars. Neutral, we won't recommend one service provider or company over another. We want to give you options and help you choose what will work best for you. And objective, we will share all the information to help you make an informed choice. So the Senior Linkage Line can help you explore a variety of local options. While we don't provide these services, we can connect you with those who do. So we help connect to transportation options available in your area. So for the Arrowhead, we often refer to Arrowhead Transit. In Duluth, the Duluth Transit Authority. House cleaning services such as help washing the floors, cleaning toilets, dusting, etc., homemaking services. All these are ways that can help you stay in your home. Food, we can help you find a dining site, get groceries delivered, meals delivered, or get a ride to the grocery store. So AEOA has a lot of senior dining sites throughout the region. They also do groceries to go and meals on wheels, home delivered meals. And then we can also help with housing. So we can help you compare your options so you can decide if your home is the best place for you to live. And then support programs would be things like SNAP, food support. We can help with applications. We can help you get help paying for your Medicare. So we can help apply for Medicare savings programs, extra help, low-income subsidy programs. And then also energy and fuel assistance. We can help connect to those programs and fill out those applications. So we want to show you your options and then help complete that application or the paperwork to sign up. We can also help when you turn 65 and you have any Medicare questions. We are kind of, scrolling too fast here. We're the Medicare experts in Minnesota. We can answer any questions you have during open enrollment period or when you turn 65. We can help after a stay in the hospital or nursing home and help you connect with resources and transition home. And we'll talk about that a little bit more in a bit. If you are helping a loved one or a friend, we can help you answer questions, share tools that might help you if needed, connect you to a support group. And then if you need help paying for prescriptions, we can help connect you to programs to help cover these costs. And this is one of our areas where we can help anyone 18 plus. And then fraud concerns. If you have any concerns about Medicare billing errors or fraud, we can help you review your information and help you report it. And that's one of our educational presentations we also offer in the community, is preventing fraud and scams. Application assistance. Like I mentioned earlier, we can help with any of these different applications: energy and fuel assistance, those Medicare savings programs, prescription assistance, financial assistance, food assistance. We can help you complete those applications so you can get the financial help that you might need. And there's a variety of ways you can connect with us. We're available via live chat on the minnesotahelp.info and our Senior LinkAge Line website, Monday through Friday, 8 to 4:30. During those hours, you can also call the Senior LinkAge Line at 800-333-2433. And there's a couple options. So you would press 1 if you're thinking of moving, 2 if you need Medicare help, 3 for medical professionals and social workers in medical facilities, nursing homes, etc., or 0 if you just need general help. You can also meet with us in person if you need an accommodation. We can partner with our interpreter services. If you have low vision, we can offer large print materials if needed. But this is would likely be at our Duluth office. We do have some options for meeting with volunteers throughout the region, but this is kind of on a case-by-case basis. We can't guarantee it, but it is an option if needed. And then minnesotahelp.info is our database of human service providers serving people across the state. You can use it to find services and service providers in your area, and it's also the search engine that we use. All of these vendors and all of these organizations are vetted by our state data management team. So there's certain criteria that they have to meet to be listed, but it's focused on older adult and aging service providers. And you can filter down geographically if they take private pay or waivers, and really get some filtered down results. And there's also a chat option on this website if you need any help navigating or if you have any other questions. And then we can also help you with our print publications. We have information on a variety of topics. So we've got our Planning Ahead guide, which has information to consider as you age, like a healthcare directive, funeral planning, financial planning, all different types of information around planning ahead. Medicare 101 provides just basic Medicare information, when you're eligible, a great flow chart of if this, then this, and gives you your options on original Medicare versus a healthcare plan. It even talks about fraud in there. Our Senior LinkAge Line kiosk card is just a simple overview of how the Senior LinkAge Line can help. And then on its flip side, it has information about that website, minnesotahelp.info, where you can search to find local services. And then on the far right is our magnet that has our phone number in the middle, and then our partners, the Disability Hub and the Veterans Linkage Line. And you can find all of these on our website. There's a tab for resources and then print materials. So they're available in PDF form. You could print them out or view them electronically, or you can always contact us and request some and we can mail some out to you. And then I will pass it over to Allison to talk about pre-admission screening.
Thanks, Jess. And if you have any questions about any of the materials, you can go ahead and pop them in the chat, and then we can maybe get to those after if we have time to, or raise your hand too. I'm not opposed to answering questions as we're going through these. So I'll try to be brief, but if you do have questions on anything that we discussed today, you can certainly reach out to us by phone or the online chat that's available on the website. So what is a pre-admission screen? It is a requirement prior to any admission to a medical assistance certified facility, which would be the 3 things here in the circles: the skilled nursing facilities, any boarding care facilities, and any hospital swing beds. So they are required to have a pre-admission screen in place regardless of payment. It doesn't have anything to do with really a payment. It's just a federal requirement that all Minnesota residents have one of these in place when they admit to one of these 3 facilities. Why is it needed? The first one is it determines the level of care the person needs and if they're going to be placed in the right setting for the needs that they require. It does connect people with services, whether or not they're in the nursing facility still or if they're planning on returning home. The process kind of starts within the facility and it can continue after they plan to return home if that's an option. Um, and it does have a little bit to do with nursing facility payment, and there are surveys involved. Because it's a federal requirement, there could be repercussions if those aren't in place when the Minnesota surveys come through. So they do need to be in their facility before the person admits. Next slide. How do you submit the pre-admission screen? You go to the next slide. You can go to a couple different places. You can bookmark the slreferral.org website, and you can do that 24/7. You'll see this page here, and you can see on the upper right-hand side, there's a green chat box. This would, if it's after hours, it would turn into like a email that would be answered the next business day. But if it's during our business hours, you can live chat with a specialist. And the first one is for help for older adults. That would be your general and professional referrals. But right now we're going to talk about pre-admission screening. So you would hit that first blue bar. And level of care determination, we'll talk about that briefly after that. But for pre-admission screen, you would hit that middle. But it's all housed under the same area for any kind of referral that a person might want to submit. So the different types of referrals, help for older adults, like I said, that would be more of a general referral. Anyone can submit a referral online for themselves or for a loved one, a person in need, a friend, family member, whichever. The pre-admission screen is specific for pre-admission screen only. You can only do a pre-admission screen by clicking on that tab. Same thing with the bottom one. Excuse me, level of care determination is only for that particular type of referral. And they are labeled differently when they come through to us, if this matters to you. But they are labeled SLL with the string of numbers for the first one. Pre-admission screen always starts with PAS, and the level of care redetermination starts with LOC, and then a string of numbers as well. Okay. The different sections when you go on to the website to submit a pre-admission screen, there are different categories. It looks like it's a lot of information, which it can be, but it's been kind of whittled down to these topics. The submitter information, which would be the provider that's filling it out, the person being admitted to the facility with some demographic information on there, a little bit of their medical information, such as ADLs, and the reason why they're admitting, and then the admitting nursing facility. And I did want to stress this too, because I used to work in pre-admission screen and we would see a lot of people not submitting them because they weren't sure of where the person was going to be admitting. And I would suggest submitting it anyways because it's better to have it beforehand and then call us with an update of where the person will admit rather than waiting after the fact. Because it could end up being a billing issue. So I feel that that's important to stress if you are a person filling out a pre-admission screen and you're not quite sure where that admitting facility might be. You can either leave it blank or you could put in the one that you think they might be going. And if you know that they're not going to end up going to that particular place and it changes, you can just certainly call us and then we can make that update for you and then send it on its way. And once you've kind of reviewed all the sections as you're going through it, there's a submission page, which after you submit it, the result section will be at the very end, and that's when that number will show up. And for this particular referral, it would be a PAS, and then I think it's a 10-digit number after. And it would also tell you if the person meets a level of care to go into that facility. And we'll talk a little bit about what that means next, I think, on the next slide. Yes. So after you hit the submit button and you have that pre-admission screen on the top of the form, a couple different things could pop up. One is it meets a level of care and everything's fine. It doesn't trigger any other need for review. However, these two here, the level of care cannot be determined, might flag on the pre-admission screen, or the next one, OBRA level 2. What this means is it just needs more review, and it could be either internal here at the Senior Linkage Line through our client service center team, or it may need to go to the county. So the level of care cannot be determined. A lot of times the information just might not be filled out correctly, and it will flag automatically if that client is under 21. The over level 2, that usually has to deal with mental illness situations and diagnoses and developmental disability. And just because it doesn't say that it meets a level of care, this over level 2 just means that it probably has to go through a little bit deeper assessing on that screen. And then if it goes to the county would end up doing the assessment and then reaching out to the facility that submitted it to go through that little assessment and ask the questions that are required to see what they need to do to get that to go through. And you can always call on it. If you have a submission and you see it and you saw, oh no, it's got the over level 2 on it. Now what do I do? You can certainly call into the Senior Linkage Line, and I believe it's that option 3 for pre-admission screen. And you can ask, what the status is. I just submitted this pre-admission screen. Can you kind of tell me where it's at in the flow chart? Where has it been processed? Where did it end up? You can certainly call us and we can look that up for you. And I do stress the accuracy because of the different information that's listed on a pre-admission screen. It can flag those two options on the submitting page. And because it ends up having to go into a state system, even just putting the wrong initial in for the person's name, the wrong date of birth, what would be another thing? I'll just go with those two for now. But if it ended up, say it was John Doe, but you ended up spelling John Doer with an R, then that little R might create more information in the state system and create a whole new person because we're just going off of what we can find in the state system and we're trying to find a match. And if it's a new person and they've never been in the state system before, that name is going to be created under the name that's submitted, and it's not always accurate. And sometimes we don't catch it and the state doesn't catch it until maybe there's been a few pre-admission screens and they kind of stack up and they have to be processed chronologically. So it's kind of a process to reach out to the company to have different screening documents removed from the system so that we can correct the original one. So it's kind of like a domino effect as it goes up. If it's wrong on the bottom and there's 4 more on top, all of those 4 on top need to be removed so that we can get to the source of the problem and fix it. And then we'd have to go back in and enter all the other ones on top of it. So it can be kind of time consuming, and it could become a billing issue for the nursing homes. So this is kind of a basic overview of how this works. A hospital can submit the pre-admission screen. However, that being said, since they have to be processed before a person admits to a nursing home, if that person is in the facility and they don't have a pre-admission screen submitted by the hospital, the nursing home can certainly fill one out. They may not have all the right information, or I shouldn't say right information, but all the the details of the hospital submission, but if they need to have that on file, they can certainly do it. Because sometimes a nursing home will contact the hospital and have them submit it, and they're just too busy to do it, or they don't get to it for a few days. Well, a few days could be thousands of dollars. So you definitely want to make sure, and that's kind of the requirement of a nursing home, and they have to make sure that that pre-admission screen is in place before that person is admitted. So technically, they wouldn't have to admit the person if that hasn't been done. But of course, when you're shuffling people back and forth and paperwork back and forth, things get lost in the shuffle, and we just don't want the patient to suffer for that. Um, so then we get the Senior LinkAge Line referral. We look to see if they are on programs, and if they are a private pay person, we would go ahead and process that screen on our end. And if they are on a public program of any kind, we would actually forward that pre-admission screen to the county for processing. We at the Senior LinkAge Line would send out notification of what we did with that to the nursing home. So they know that we sent it to the county for processing. And the managed care group is supposed to send a copy of their results to the nursing home. So they technically would have two letters coming in, or two faxes, or two email confirmation letters to that nursing home to let them know that it's been processed and they're good to go. Like I said, the Senior LinkAge Line sends the pre-admission screen. It's not this, we do send a copy of it, and then we send a cover letter letting them know this person meets level of care. They're not on any public programs, or we did send it to the county because this person is on an M-SHO plan with UCare, and they are responsible for actually processing that pre-admission screen at that point. And then at this point, there could be a chance that we could do follow-up. So we would be continuing to help that person if they are in the nursing home and they would like to go home, which is kind of the next piece of what we'll talk about, which is the resource coordination team and the return to community program. And how that can work kind of stems from the pre-admission screen. There's criteria that get submitted on the pre-admission screen that could potentially flag a referral to a resource coordinator, such as myself. And then we would reach out to a social worker at the facility, and we would talk with them about what the plan is, what the person would like to do when they're discharging. Are they okay to go home if they had services? So we can kind of get into that after. But these are the criteria on the pre-admission screen that would flag for a resource coordination referral. They would have to be 60 or older. They would be private pay. However, if they're on straight MA, we can still help them. It's just the managed care groups. Obviously, with managed care, they should have a care coordinator or a case manager that is coordinating their care. So we wouldn't want to step on their toes. It'd be like double dipping. So we would just want to stay with the private pay folks and the MA. Case mix on the screen, if you're familiar with case mixes, there's A through F or L, and those stand for their low needs, I guess, for a better, don't know how else to explain that. So they have very low needs. So they would probably be a good candidate for receiving services in the home if they were to be discharged back out into the community. And they have to give consent on the pre-admission screen. There is a question on the very end of the pre-admission screen that hopefully people at the hospitals and nursing homes aren't overlooking. That's an opportunity question for the provider to ask the client and discuss what we do here at the Senior LinkAge Line, and asking their permission, or see if they want to find out a little bit more about services that we offer here. But you just have to basically ask them. And I think the question says something about, did you get permission for Senior LinkAge Line to contact you? If you say yes, then we're golden. If you say no or did not ask, it just won't flag for the resource coordination referral. So it's very important if you want to have us reach out to them, that question needs to be yes, along with these other 3 categories on top in those bullets. There is another way, however, and we'll talk more about that after these slides. Communication with the nursing home social worker. That will happen usually 7 to 14 days after admission. And then we could also be calling the social workers about more than one person that may have admitted. We try not to bug the social workers too much, so we're not calling like daily if people are admitting one after the other. We try to keep them kind of grouped together so that you can get along, go about your day. Some of the things that we might ask, which would be the current status, how long have they been there? What's going on with them? What are their discharge goals? Are they in therapy? Do you have any idea like how long they might be staying there, that sort of thing? Can we contact the person in the facility in person, or would they be able to even have a visit, or would it be better to call? Maybe they aren't able to talk on the phone quite yet. Maybe they have a loved one that we could contact instead. And then any relevant details that might help with um, helping them discharge back home. So we kind of act, pre-admission screen is a requirement to put them in the nursing home for their level of care. And then we're going to talk about resource coordination, and they try to help get the person back out of the nursing home and into the community if that's what they want safely, so they can be in their own homes for as long as they want to be. And we do try to help prevent repeat admits to the nursing homes too. So we try to work with the social workers. We're kind of like an extension of what they do when they're discharging them. And we try to continue helping them as they go back home. Okay. Um, So the help for the older adults referral is where we're going to talk about online referrals for the return to community. It could be a lot of different things that you can submit a referral for. It could be from an individual, could be from a provider, it could be from a caregiver, it could be for and from family and friends. It could be a variety of things, kind of like what Jess talked about. There could be transportation needs, Medicare questions, prescription plan questions, you name it, anything that you can think of. You can certainly try and submit a referral, and we will try to kind of triage that to see what area you might need to talk with someone. It could be an information and assistance specialist, a Medicare specialist. It could be like myself, a resource coordinator. It could be, I guess it would be just those two, because pre-admission screen and level of care redetermination are its own animal. But my point is anyone can submit a referral, and it can be just about anything that the person might need. So when in doubt, I would send us a referral. If you're thinking about the pre-admission screening criteria and you're a submitter or you're a receiving skilled nursing facility and you're not quite sure if that pre-admission screen might cut, you know, um, not cut, but fit the bill for a referral to the resource coordination team, you can do an online referral for that person as well. It might double up because we might also receive it on our, what we call a profile list. It's the resource coordination referral. But if you're not sure of that, and you wouldn't know anyways, I don't think, unless you're really paying attention to what those criteria items are, you could certainly submit a referral. And if we have two, that's fine. We can just use one or the other, but I'd rather see too many than not enough. And then that person doesn't get the help that they need. So there are options. So a provider can submit a referral for an older adult, especially if maybe they're going home, but they don't feel like they can do it with what the person's told them about their living arrangements. Maybe they've got, a lot of loose rugs and had some tripping hazards or something to that effect, and they need some help around the home to help make sure that that falling isn't going to be an issue anymore. Maybe they need grab bars in the tub or something like that to help. Why are they falling? Maybe we need an assessment from the county to see if we can get somebody else out there. So there's a lot of different combinations, I guess, out there for a referral. So I just want to make sure that you know that it is there for you for a resource. And if you have a question about it before you make the referral, you can do a chat too, and you can, see if that would be, something that's worth, sending in on the online site.
And I just want to hop in here and
Mhm.
make a note that the person being referred does need to be okay with this. We do need their consent. So if a caregiver is a primary contact, we need legal permission to talk to them about the person's private information. And if you're submitting on behalf of someone, that person does need to be okay with being
Mhm.
referred. And as an individual, you can self-refer too.
Right. So the resource coordination, what we do is we try to assist the older adults remain in their home or discharge from a facility as safely as we can with the proper services in place if they are available. That is a huge issue right now, is trying to find services in the area that are fully staffed that can do these. So I just want to make that very clear that sometimes it is a struggle, especially in the rural areas. The farther out you get, it's sometimes a challenge. So even though you do submit a referral, it may not be immediate, or if at all, a possibility to find services. So we do get creative, but that is our goal. And we do offer ongoing follow-up. If a person chooses to sign up for our follow-along service, we can follow them up to 5 years. So the social worker would help, that initial discharge planning, and then we would kind of take the baton from them and we would kind of keep that race going, and we would follow up. Usually, after they sign up, we start calling them at three days out. We develop a support plan, and then we kind of follow that up, kind of like a checklist, I guess, if you will. But we try to empower them to do a lot of this on their own with encouragement and help from us, yes, but we try to allow them to make decisions on their own because we are non-biased, of course. But we do offer that ongoing follow-up. And then we try to support the family members as best we can and the caregivers as well. So here's our overview of the resource coordination process. Once the person is in the nursing home, we'll just use that one because that'll be like a profile list one that was stemmed from the pre-admission screen. We would reach out to the individual after contacting the social worker and making sure that it's okay, we can come in and talk to them. We'd reach out to the individual and or a caregiver. We would discuss the help that's available after we, found out a little bit more about them and what their goals are, and finding out if they are agreeable and if participation is right for that person. We would have a pretty in-depth assessment for that person and create a support plan. And then we would mail that out to them or email or just have it with us in person. And then we would assist with the resources and referrals. So what that would mean is if we needed to help them reach out to the county to see if they needed help with applications, we could reach out to our internal staff with assisting on applications. If they had questions on Medicare, we could reach out to staff members that were specialists in that area as well. Um, so it's a real big basket with a lot of things that we put in the basket to help this person, basically. And then once they're discharged from into the community, then we would reach out to them by phone or in the home personally. We might go and do a home visit too. And we do like to do that at least once a year if we don't do it in the beginning. Even if we do it in the beginning, depending on how long we follow them, we would like to follow them again and just kind of touch base with them in person, see how things are going. And then following up actually starts when they're discharged from that nursing home into the community. So we would start by doing a 72-hour call. We do a 10-day call, then it's 30-day, 60-day, 90-day, and then I think it's at 6 months or something. So it kind of spreads out a little bit, so we're not constantly bugging them on the phone, but we do like to check in. And we also let them know that if, they need to call us, they can do it at any time they want to. So. Okay. I can talk to you a little bit about the online referral. If the online referral comes in and they're not in the nursing home, it's very similar. We would just reach out to the person directly, whoever filled it out, and then we would kind of go through the same process basically, but they are already in the community if they're doing an online referral most of the time. Sometimes people will do an online referral, say for themselves, but they're still in the nursing home because they're not sure what's going on. So we would either go wherever they're at, basically. We could do it on the phone, we can do it in person, we can go to the setting where they're living at the time the referral came in. So, okay, next slide.
So our next slide is about volunteer opportunities. Do you want to share your
Oh,
case studies first?
I do, I do. So I have a couple case studies here. So the first one here, this gentleman that I work with, he ended up receiving a self-referral for this woman. So this person was at home, something happened, she went out onto the website and she did a self-referral. So my coworker reached out to this woman, and what had happened was her phone had been stolen. She had had a little bit of cognitive issues, and I think that was elevated because of the stress that she was going through. But the problem was she couldn't just call AT&T and get a new phone because she had no ID. And so what Lee did was he had a nice, extensive conversation with her, and he ended up helping her call AT&T, and they got permission from the woman for Lee to talk to AT&T about this situation. And they weren't going to do it. They weren't going to let her have this phone. And Lee really worked with him a couple different times, actually. And it boiled down to he had to explain pretty in detail what had happened. And this woman, that's about the only lifeline she had. It was the only way that she could communicate with her family. She didn't have a landline or anything, but she was kind of stuck on her own and she didn't know what to do about it. Well, this coworker really kind of pushed back on the AT&T, and they ended up being able to have the woman buy a phone outright without an ID, because if you sign up for a plan, apparently you have to have your ID on file or whatever. So he went above and beyond this AT&T worker. And of course, he had to go through a couple different people at AT&T to get to the right person. And they were able to have the woman buy a phone without having any ID. And she got back on track. And because of the cognitive issues, she was trying to get onto her iCloud account on the new phone, and he also helped her try to retrieve her iCloud password, which I think we all can agree that can be difficult sometimes, any kind of password situation. Um, and he just was very patient with her, and he really worked with her. And he just asked her point blank, okay, let's just not think about anything right now. And he said, well, if it were a password that you would like to have for this particular thing, what do you think it would be? And just jot it down on a piece of paper. And he was at her house. He was visiting her in home when they were doing this. So she's in her environment. She's pretty calm and she was in her happy place. She's got her new phone. She jotted down the phone number and it ended up being the right password for this person. So it was kind of a lucky draw, but it ended up working out and she was very good. And they ended up getting her a phone case that she could wear, kind of like a crossbody style around her neck, so that she wouldn't misplace it or set it down and then have that be a risk of theft again. So that was kind of nice. Another one, Another coworker of mine, a different one, she had ended up talking to a person on the phone for over 2 hours because she was just so confused about what was going on in her life. I'm just going to read this, what she wrote. The client had a lot of confusion, trust issues, stacked up paperwork, not knowing what to do with it. I called this woman to discuss the senior linkage line and was on the phone for almost 2 hours. After gathering some information, I reached out to a volunteer coordinator to discuss in-person LIS extra help application assistance. During my communication with the client, it was figured out that she needed to do an online form in which she did not have internet access. During the entire process, she was ready to give up. She would call me numerous times a week just for support and encouragement. She had the application completed by a volunteer, and a resource coordination person, specialist, was able to get her connected with the Medicare specialist to discuss her insurance plan that was to take over the beginning of the new year. Turns out that she had everything in place correctly, and a few weeks later, she received a call from the client stating she would not have been able to hold things together without the help of the senior linkage line and the support of the resource coordinator. And she did tell her that she was very appreciative and that she was a very special person for being so understanding and patient. So we do have to we have to be patient. We have to be able to listen and be active listeners. And sometimes people just need another person to support them, and they might not have anyone. They might not have a friend or a family member that is willing to listen for that long of a period of time, because maybe a family member or a friend member might think they're just rambling and they don't want to listen to it anymore. Well, sometimes we're kind of the sounding board. So we have to be patient, and it really pays off sometimes. And that's a good example of that. The third example, a client had been working with a caregiver consultant from an outside agency. She didn't specify which, who made the referral for our follow along services to our resource coordination team. The client was a primary caregiver to her husband who had had dementia with increasingly difficult behaviors for the client to handle independently. And English was not the client's first language. So she needed a comprehensive in-person assistance meeting to discuss options to help them both remain in their community home. The resource coordinator brought medical assistance applications to the family, spoke to them about a min choice assessment and how that all works, and helped organize proofs of the income and assets to establish in-home services for the husband through medical assistance. When he was admitted to the hospital, the resource coordinator was the point of contact for the hospital staff to reach out as they could not communicate with the caregiver. The staff at the hospital believed that she was having issues understanding what the care team was proposing and needing her to do. Although the client had issues with cognition and English not being her first language, she was very offended when the staff brought in a translation machine. The resource coordinator was able to speak with the caregiver about what the staff was proposing and what the next steps for her family would be. The resource coordinator also assisted in establishing the family with fuel assistance, SNAP benefits, and one roof housing programs to assist in home modification. When the husband passed, she also assisted in exploring and applying for burial assistance through the county, as well as ongoing follow-up and support. So this one was pretty extensive. She spent a lot of time with these folks. And essentially, she implemented every service available that she could think of to assist the client remain independently at home with her husband and after her passing. So some success stories there. And they're not always success stories, believe me, but we do have a lot of them as well. So
Thanks for sharing all of that.
mhm.
Allison mentioned our volunteers often get involved in some of these cases. They help with a variety of different things, but they can help people fill out applications, like was mentioned. They can help with those extra help and Medicare savings programs applications, MA, and we're always looking for volunteers throughout the region. Like Ashley mentioned at the beginning, our Arrowhead region covers Aiken, Carlton, Cook, Itasca, Koochiching, Lake, and St. Louis. And we provide training. So once you become a volunteer, or when you become a volunteer with us, you receive training to become a SHIP certified counselor. So you can do Medicare options counseling with folks. You can also give presentations like we have today. We have some other presentations that are more focused on Medicare, Medicare 101, new to Medicare. We've got our fraud specific, preventing fraud and scams presentation, and then we have a presentation on our money saving programs and services. We have a presentation on that. So that talks about those Medicare savings programs and that extra help and low income subsidy program. If you're interested, you can reach out to us, 800-333-2433. Anywhere in Minnesota, you can reach out and find out more information about your local volunteer opportunities. And I also do want to mention that you receive mileage reimbursement. And as the volunteer coordinator, you'll receive my support here in the Arrowhead, and just the knowledge that you've made a difference in your community. Again, our partners that we can connect you to, you can connect with. The Disability Hub, they answer questions on disability benefits, any question related to disabilities. The Veterans Linkage Line, they answer questions about veterans benefits and services, but there's kind of a no wrong door approach with us. So if you call, say you call the Veterans Linkage Line, you have questions about Medicare, they'll refer you to the Senior Linkage Line. If you call us, you have questions about your disability benefits, we can refer you to the Disability Hub, we can transfer. So if you have questions about any of them, feel free to call any of us and you will get connected to the right folks. And I'd like to open it up for questions.
I'm not seeing any in the chat, but if anybody wants to come off mute, feel free to do that. Otherwise, continue. You can put the questions in the chat. If you have questions afterward, feel free to email me. My email is in the chat and I can make sure I can get those answers from either Jess or Allison. But I want to thank you both for presenting today. This was great information and I think this will be very useful to a lot of people.
Yeah, thank you so much. And if there are no questions, we do have just a quick survey from the Administration for Community Living. Your responses are anonymous, but it will help improve our programs, our services, and our presentations. So there's a link. I can put that in the chat. Otherwise, if you have your phone and you're viewing this on a computer, you can just scan or take a picture of that QR code and take that survey quick. Thanks for having us, and thanks everybody for attending.
All right. Well, thank you again, both of you. I just want to quick share about some upcoming webinars that we have. We are doing one in March on practical modifications for comfort and safety, creating accessible homes. And then in April, we will be launching our advanced planning campaign. So we have 4 great webinars on all the different areas of advanced planning. So we have one on power of attorney. We have one on navigating the end of life care. And then we also have effective conversations on advanced planning care. And then last will be on the healthcare directives. So, and I'm gonna just pull up the ways to connect with us. You can find us on Facebook, LinkedIn, our email address is up there. And then of course, our videos will be, video will be uploaded onto a YouTube channel. And you can also find our past presentations on there as well. So thank you again, everybody, for joining us today and have a good day.